Thank you all for being here, and I'd like to actually thank Amber and Ann from Natural Resources for organizing these workshops and making us get out into the community and talk to folks across these 5 communities where we'll be holding these workshops. I'm with the Department of Public Health, the State Public Health Department, in our Health and Human Services Agency, and I'm going to be speaking a little bit about the overview of public health. I have the reputation in this group of being the people person, which I think is actually befitting a representative from the Public Health Department. So I'm going to have a lot more people in my pictures. So before we start in on looking at climate change and the impacts of climate change on health, we really need to understand the health of the state of the people of the state of California, because that's the basis upon which we will need to understand and appreciate and plan for the existing and coming impacts of climate change. With our 38 million people in the state, going towards 50 million by 2050, let's just take a snapshot of who that is. We're the most diverse state in the United States, with a multitude of immigrants and diversity of language and culture and immigrant status, and that's an important feature of our communities around the state. We're an aging state. By 2050, 1 in 4 people in California will be over 65. So that's a considerable thing to think about planning for the future. And while we're today in California, we could say we have one of the best profiles of health of our population ever. That health is not equally distributed across our population. So with the diversity goes a lot along the lines of race, ethnicity, and income, quite a lot of disparities in the access to and experience of having a healthy life in California today. And that will be a considerable thing to take into consideration and plan for in the future, thinking about climate change. As Bill said, 5% of our population 5% of our land mass is urban, but 95% of our population lives in urban areas in California. So for our department, our goals for climate change and health are to participate actively in the Climate Action Plan, representing our knowledge and research and expertise on the health of our population. And increasingly, one of the issues that we're paying close attention to and moving up our line of priorities is health equity, because the state cannot be healthy unless all of our population has access to services, opportunities, and healthy communities. We also are trying to develop our own capacity to work in the arena of climate change. I would have to say that the health, and especially the social service sector at the state and the local level, is not up to speed on climate change as many of our resource and infrastructure sister agencies are. And that is a challenge for us to reach out and engage those other agencies and people working in the human services, because in fact public health is the human dimension of climate change, and we need those partners to know what's at stake and what kinds of issues are going to be coming up in the future. And also, public health infrastructure in the state of California doesn't stop with the state agency. Our infrastructure goes down to the local level with 61 local health departments at the county and city level. And this is an absolutely integral and critical part of the public health infrastructure, and so we see that continuum as what public health in California really is. And our partnership with those local entities is critical. And they too are really just getting their hands around and learning more about how they can start planning and working on climate change. So just very briefly, I just wanted to walk through, you've all heard you could all probably rattle off what the major health impacts of climate change are, but what are the pathways by which we actually see those turned into risks and issues at the community level that impact different segments of our population, and especially vulnerable populations. So the main changes are ones you've already heard by other presenters here this morning: temperature, sea level, and hydraulic, the changes in our hydrology system. And those translate into kind of weather condition changes and events, such as heat waves, or extreme weather, which also impacts air pollution. And each of these in turn translates into health effects and health impacts on certain that have a differential impact on certain regions of the state and certain populations in our communities. And so as health planners, we need to understand these pathways well in order to see how we can integrate what we're already doing to protect and promote the health of our communities around the state, as well as to add the climate impacts into that understanding. Allergies, vector-borne diseases, waterborne diseases, food safety, and foodborne diseases. These are all things that we do today, but we need to really look at in the context of what additional risks will a changing climate bring to all the many facets of protecting and promoting health. And I want to also make a point of the more indirect pathways, things you may not think about, that we feel we need to look quite intently at. And those are things like rising energy, food, and water costs, which take a disproportionate toll on low-income households in the state. So for increasing temperatures, that's year by year the temperature's going up, but it's also the frequency and duration of extreme heat events, which is where we see particular health problems increasing going forward, and those are related to heat illness and death. They make people with other health problems have a harder time in those events, especially people with chronic diseases. Heat translates into the formation of more ozone and more air pollution, and that's particularly concerned for asthma and people with respiratory conditions, but also with chronic cardiovascular disease. And in this case, there's a number of high-risk populations that we need to understand and integrate into our planning, and including educating the medical sector more about the coming needs around climate change and health. So the elderly, and we know our population is aging, those who are socially isolated, the very young, outdoor workers. Fortunately, California has a standard to protect outdoor workers, but that probably is not climate ready itself. And those without access to air conditioning and other forms of cooling environments. For wildfire, which you just heard about, that translates into, from a human health perspective, in the area immediately adjacent to the wildfire, injuries and death, displacement and loss of homes and jobs, and also air pollution, not only just in the area of the wildfire, but transported to areas, in some cases, quite distant from the wildfire itself, depending on meteorologic conditions. And that wildfire, as we all see in the rim fire area, will create flooding and erosion problems and water quality problems as we go into the winter. So all of these translate into health concerns that public health is looking at and trying to plan for. I grouped this into a pretty big category, but it's extreme weather and water-related events that will impact health. And let's just look at a few of those impacts. So there's direct impact on health of people in the way of an extreme weather event, whether that's a flood or an extreme precipitation event or a storm. But there's also very serious and long-lasting mental health problems. If we look at the experience of Katrina or more recently Hurricane Sandy, mental health effects go on for quite a long time to the population that are affected by extreme weather events. Their town may have been destroyed. Their housing is disrupted. Their whole lives really are turned upside down. And this has very long-lasting mental health and economic consequences for those people who experience those directly. So there's a lot of economic damage, which also translates into health problems later on. When people lose their job or their footing in their community, frequently that manifests in health problems at some point. Also, we have the potential for damage to healthcare facilities. Many clinics and hospitals are also, like other facilities, located in areas that now are going to be subject to floods, sea level rise, and other conditions that maybe when they built there, it wasn't a problem. And our health facilities are quite prepared for natural hazards from a historical vantage point, but I think our hospitals, our 400 hospitals around the state, are really just coming to grips with what the world of climate change means to them. Some of these things other people have discussed, but obviously drinking water is impacted when there's floods. Toxic materials or contaminants may be washed away into a flood zone or into other areas. There could be saltwater intrusion, so water quality, especially of drinking water, which is the area that we have authority for, is of great concern. And then there's damaged infrastructure, which especially sewer treatment plants or water treatment and others that have a direct or indirect health effect. Warming seawater also has a health effect. So we're seeing more growth of something called harmful algal blooms or blue-green algae, which has both a contact and ingestion health impacts. And this is one of those areas we just need to study more. We don't know that much about it and how rapid or extensive the growth may be, but with a 1,200-mile coastline and people who like to visit the beaches of California, this could be a larger concern. So since the 2009 plan was developed for the adaptation strategy for the state, CDPH has been trying to identify several large focal priority areas that we could spend our time and our resources on getting started in this area. And the first one that we felt demanded our attention was really preparing for extreme heat events. So I believe today, or possibly tomorrow, we will be releasing a new guidance that was loosely modeled on the sea level rise guidance that you heard about earlier, to try to help local planners and other state agencies get their hands around what do we mean by increasing temperature and extreme heat? What is that going to look like? How will it manifest itself? And what do we need to really do to decrease the risk to our population around the state? It's called Preparing California for Extreme Heat, Guidance and Recommendations. We've also been looking at vulnerability assessments, but instead of for forests or for water, we're looking at vulnerability assessments for people. Who are our most vulnerable communities and populations within those communities? Because for each impact, for each hazard area, it may represent a different risk for different kinds of people. And in part, we just need to develop methods for doing this that aren't completely top-down, that give the local community a chance to interact with the data and themselves understand how they can use that data in their planning. Public health is also in a very good position to participate in planning and developing community education. This is one of our core areas of expertise. We constantly are explaining to people around the state something about some health risk factor that we think they need to understand and take action on. And so we see climate change as a health issue in that regard, that we can bring to bear the resources and expertise we have to do community education, to get people to understand climate change is a health issue. It's not just a distant, far away issue. It's not only an environmental issue. It's a human health issue. And like I said, the local public health departments, wherever you're from, your county has a public health department. You should get to know them. They're really involved in a lot of things in the community, and we're trying to help them develop the technical expertise and capacity themselves to do this kind of planning and assessment at the local level. So just to touch on the vulnerability assessment, to give you an example, this is acquiring vast amounts of data, some of which we have to really pour through to see what its significance is, and then apply it to the climate change models itself and see what we can learn about the pathways of exposure, the ways in which people become vulnerable, and what happens to them when these events occur. So this was a pilot study that we did in Los Angeles County, where we looked at a whole series of climate change impacts: wildfire, flooding, and heat, and sea level rise. And we tried to create an index showing who in Los Angeles County really had multiple impacts or cumulative impacts to them whether that's lack of air conditioning or exposure to floods or wildfire smoke in the LA basin. And what we found, not so surprisingly, is that African Americans and Latinos lived in areas that were at much higher risk, and they themselves socially and economically were at higher risk for impacts if these events were to occur. So that is a very short kind of thumbnail sketch over the public health area of adaptation planning, and I'd be happy to take any questions that you have. Or we can move on to transportation and water. Thank you again.